The last part of the flu vaccine training will go over some of the key components for setting up a safe vaccination clinic. This will include things to do before the clinic, on the day of the clinic, and to optimize the clinic flow. Before the clinic, determine if you will need help with your clinic and contact other providers, nurses, and the New Mexico Medical Reserve Corps for volunteers. All clinical volunteers are asked to sign up through the New Mexico Serves, or the NMRC, the Medical Reserve Corps. In the metro region, the New Mexico Immunization Coalition may be able to help arrange for health science students to help out with clinics. Be aware of the requirements for volunteers and make sure that your volunteers comply with proper background checks. When starting to plan for your clinic, determine who will be the clinic lead. If you are using volunteers or health sciences students, make sure that they are properly trained and that for students, a licensed preceptor accompanies them to provide oversight and supervision. Brief your volunteers on the day of the clinic as to their duties and responsibilities, and do that before you start your clinic. Be sure to discuss emergency plans and designate who will call 911 if necessary. Let your team know to tell the emergency services that a patient is having a reaction to a flu vaccine that was just given. Provide a just-in-time training before your clinic gets underway, and consider having some snacks and beverages for your staff and volunteers. Make sure that all your clinical volunteers have completed this flu vaccination training. They also must meet the volunteer requirements, which could include background checks and fingerprinting. Clinical volunteers will be signing up with the New Mexico Serves, the Medical Reserve Corps, who will check all clinical volunteers' licenses to make sure they are current and in good standing. In addition to completing this training, all vaccinators must have completed HIPAA and OSHA bloodborne pathogens training. They must sign a volunteer agreement form. This form allows the vaccinators to operate under the Department of Health protocol and will allow Department of Health to bill for vaccine administered by those who are not employed directly by Department of Health. Health sciences students must be supervised on site by a preceptor, and they must also comply with these requirements. Here's a screenshot of the volunteer agreement form. The dates can be from October 1st, 2020 through September 30th, 2021. The Department of Health supervisor will be Andrea Romero, and the location that is listed can cover several or many flu outreach clinics. It can be generic flu clinics in the Albuquerque metro area, for example. When picking up vaccine and supplies, double check that sufficient amounts are packed and that all the necessary items, the protocols, and the equipment are included. Provide a briefing to your team, review the protocols, and be prepared to provide a just-in-time training if needed. Patients waiting to be vaccinated should be lined up with at least 6 feet in between patients or families of patients, and they should be lined up away from the administration stations for your flu vaccine. Give your vaccinators breathing room so that they can have the space and calm they need to minimize administration errors. In addition, children who are waiting should not be able to watch other children getting vaccinated. This can heighten their anxiety. If one child starts crying, it can be contagious to the children who are waiting. If you are holding a drive-through clinic, physical distancing of the patients is not an issue. But be sure you have physical distancing for your teams as well, and make sure there are folks who are ready to help direct traffic for optimum flow. We hope that this training has provided you with the tools and suggestions to make your flu clinic successful and safe. Reviewing the vaccine formulations, the Department of Health protocol, and administration techniques will help to minimize errors and maximize your success. Thank you for your participation in this important public health effort, and know that you are offering a great service to your community and to New Mexico. If you do not feel you have received adequate training or need additional practice to deliver injectable vaccine or flu mist, please let your supervisor or local public health nurse know, and they can provide additional guidance. And lastly, here are some useful links that may help you in preparing for your flu clinic. Thank you.